Hello everyone, my name is Maharlika Diarse. I'm going to be doing the head to toe assessment skills video. Before I start, I have my Nightingale badge, Nightingale scrub top, Nightingale scrub bottom. I have my stethoscope, my hair is tied back, there's nothing on my nails. I don't have a pen light, so I'm going to use my phone light. And I also have gloves. All right. And this is my patient, Miss Diarse. Alrighty, before I enter the room, I'm going to knock on the door, provide privacy curtain, and wash my hands. And I will now put my gloves on. Hello, Miss Diarse. My name is Maharlika. I'm going to be your nurse today. Could you please verify your name and date of birth while I check your wristband?
My name is Wilma Diarse, 12/12/1965.
Perfect. I verified her name and date of birth. And before I start, I'm going to check her vital signs. I already checked her vital signs. Her vital signs are 118/72. Her respiratory rate is 16. Her temperature is 98.2 oral. And her pulse rate is 86. And her O2 stat is 98%. Miss Diarse, are you in any pain right now?
No,
From a scale from 0 to 10, what is your pain level?
0.
Okay, perfect. All right, so now I'm going to start with the head, ears, eyes, and throat. We're going to work from the head to toe. So now I am going to check for pupillary constriction with my pen light. So I'm going to check both eyes. All right, can you look forward for me? I'm going to check, and both pupils are constricted. Perfect. And can you please look over here? Perfect. Okay. So both of her eyes have a good accommodation. I'm going to visualize her sclera and her conjunctiva, and there is no discharge or anything. Everything looks clear. Perfect. All right, so now I'm going to pull up the Snellen chart. The eye chart. All right, Miss Diarse, I'm going to have you cover your right eye. And can you please, and this is 10 feet away, can you please read line 5 for me?
PECFD,
Perfect. And now line 3.
FP,
3.
TOZ,
Okay, perfect. And can you cover your left eye for me? And can you read line 4
LPED,
and line 5?
PECFD.
Perfect. She has 20/20 vision. Perfect. The Snellen chart. We are done with the eyes. Is it okay if I palpate your nose to check any sinuses? Okay, so I'm going to palpate her nose, check if there's any tenderness, any swelling. Do you have any tenderness,
No.
swelling? No? Perfect. So, do you have any pain around your nose?
No,
No pain. Now I'm going to check with my pen light her nostrils. Can you look up for me? I'm going to check if there's any abrasions, contusions, lacerations inside, any redness. No, and the septum looks midline. Everything looks great. Nose is symmetrical. Now I'm going to have you hold one nostril at a time. Press your nostril. What? Yeah. Press your nostril one at a time, and then breathe in and out. Okay, and the other one? Perfect. Can you breathe fine? Is your breathing good?
Mm-hmm.
Okay, perfect. So good patency. Now I'm going to visualize the patient's lips, and they are pink and moist. Can you please go ahead and open your mouth, and I'm going to check with my pen light. Open your mouth. Perfect. All right. Gums are not bleeding. She has most of her teeth. The tonsils are not swollen. Can you stick your tongue out for me? And side to side. Perfect. Alrighty. I checked her hypoglossal nerve and it is intact. It is perfect. Gums are not bleeding. She has most of her teeth. Tonsils are intact and not swollen. Alrighty, now I'm going to assess your ears. I'm going to check with the pen light again. And I'm going to check if there is your tympanic membrane is not swollen. Okay, and I'm going to check the other side. Everything looks clear. Moist. Perfect. Alright. There is no discharge as well. Now I am going to palpate. I'm going to palpate her neck. Can I palpate your neck? I'm going to check for any swollen lymph nodes, any masses. There's none. Perfect. So there is no swollen lymph nodes. I'm also going to check for her tracheal. Everything looks great. There's no tracheal deviation. Now I'm going to move to lung sounds. So now I am going to put my stethoscope on, and now I'm going to have you take a deep breath. Alrighty, take a deep breath. Take a deep breath. Take a deep breath. I'm going to check the back. Take a deep breath for me. Alrighty, right here. Perfect. So both lungs are clear and equal anterior and posterior. Now I'm going to check the rise and the fall of the chest. Can you breathe for me? Okay, can you breathe normally? Alrighty, perfect. I checked her chest. The chest is equal. Have you had any coughs lately? No coughs. Have any productive coughs? No? Okay. Okay. How about any shortness of breath?
No.
So now I'm going to move to cardiac. Now I'm going to listen to your heart. Is that okay?
Mm-hmm.
Okay. So now I'm going to put the stethoscope on. Now I'm going to listen to her heart. And okay, dokie. I'm going to listen to your heart. I listen to her heart. The sinus rhythm. It is sinus rhythm, and now I'm going to check for her radial pulse bilaterally. I'm going to check your pulse right here and your pulse here. Okay, perfect. Okay, I checked her radial pulse and it is +2 bilaterally. Now I'm going to check your pedal pulse. And it is +2 bilaterally. Now I'm going to check her capillary refill on both her fingers. Can I see your fingers, please? And her capillary refill for her Hands are under 2 seconds. Now I'm going to check her toes. And her capillary refill for her toes is under 2 seconds. Now I'm going to do an abdominal assessment. Is that okay with you? Mm-hmm. Okay. So first I'm going to, can you lay back on the chair? I'm going to lift up your shirt. Okay, so now I'm going to inspect if there's any masses, any bulges, any abnormalities or pulsating masses, and there is none. So now I'm going to osculate the right lower quadrant, and typically when I osculate in real life, it has to be 5 minutes, but for this skills video's sake, we're gonna go a little bit faster. I'm going to osculate your right lower quadrant. I'm going to osculate a little bit down here. Yeah, right here. Alrighty, right here. Yeah, right. Alrighty, perfect. So now that I osculated her, all her quadrants, 5 minutes each, the patient has normal active bowel sounds. And now I'm going to palpate your abdomen, and you might feel a little pressure. Tell me if you have any pain. Just let me know if there's any pain while I push or release. Okay, so now I'm going to palpate here. Any pain? Any pain? Any pain? Any pain? Perfect. No pain. Patient is not in pain. No masses. And when was your last bowel movement?
This morning.
This morning. Was it normal?
It's normal.
Soft, large, medium?
It's normal. Medium.
Okay. And the color was brown or any... What color was your poop? Brown?
Yeah.
Okay. And her bowels are normal. Now I'm going to check her integumentary from head to toe. I'm going to start from top to bottom and all the way down. Now I'm going to check your head. I'm going to check if there's any hair loss, any contusions, any dents, or anything is deformities or anything. And there's no contusions, any abrasions, nothing. Everything looks normal. No swelling, no bony areas. So now I'm going to check everything. Sometimes there's skin breakdown behind the ear. Nothing. There is no skin breakdown. So now I'm going to check her arms. All the arms are okay. Perfect. Checking all the arms. Going to check her wrist. Check this way. Alright, perfect. No skin breakdown. Everything looks normal. Now I'm going to check her legs. I'm going to pretend that I see her legs, everything. We have to check behind the ankles. Normally there's skin breakdown there. No. Perfect. Everything looks good. I'm going to check the back. Normally when the patient is head to toe assessment, she would be laying down. But in this case, let's just pretend. I'm going to check her back. And normally the skin breakdown would be in the sacrum area. But everything looks normal. Everything looks great. Perfect. And now I'm going to check her feet as well. Alright, checking her feet. Perfect. Okay, perfect. So, there is no skin breakdown. So now I will do the musculoskeletal section. And now I'm going to do the range of motion. Miss D'Arce, can you please do range of motion? Does everything feel right? Now backwards. Everything's okay?
Yeah.
Okay, so now I'm going to do push and pull the arms. Can you please pull down your arms while I push up? Okay, and then pull up. Pull your arms up. All right, perfect. Okay, now I am going to push and pull the legs as well. Can you push up? Push up on my up. There you go. And then push back. Backwards. Yeah, there you go. Back. Back. Yes. There you go. All right. So now the feet. Push down on your feet. Perfect. And up. Perfect. So now I'm going to move around the ankle area. I don't know if you guys can see it. Can you rotate your feet and the other way, please? All right, perfect. So now I'm going to assess the patient's gait. Ms. D'Arce, can you please stand up? And can you please walk that way? All right, and then this way and around. Patient has good balance, good gait, strong gait. Okay, can you please sit down, Ms. D'Arce? All right, perfect. Her balance and everything is great. Do you have any joint pain?
No.
No joint pain. Okay. Okay, Ms. D'Arce, what is your first and last name? What is your first and last name?
Wilma D'Arce.
Do you know where you are?
In my house in Murrieta.
Okay. And do you know who the President of the United States is?
Biden.
Okay, perfect. Alrighty, so now that we completed the head to toe assessment, I am going to, she's alert and oriented ×3. She has perfect gait. And now I am, Miss D'Arce, do you need anything right now? Any juice, water, or you're okay?
No.
You're okay? Okay, perfect. If you need anything, just let us know, okay? And so now I'm going to take off my gloves, dispose of it into the trash. I'm going to wash my hands. I'm going to undo the privacy curtain, and I'm going to document my findings. Thank you everyone for my head to toe skills assessment video. Thank you.